Hello, expecting mothers. If you're watching this video, you might be concerned because you haven't felt your baby moving as much as usual. It's a common worry, and today we're going to go over what you should do if your baby isn't moving in the womb, and how you can manage that anxiety. But before we dive in, make sure to check out the description below where you can find helpful baby products for your journey. There are some great tools and items that can offer additional support throughout your pregnancy. Now, let's dive into what you need to know. First, let's talk about why fetal movement is so important. During pregnancy, especially from the second trimester onward, you'll start feeling your baby move. By the time you're around 20 weeks pregnant, those movements should become noticeable. These movements are essential as they indicate that your baby is growing and developing as expected, but not every baby moves the same way or at the same time, so don't panic right away if your baby has a quieter day or if you haven't felt them move for a little while. It's important to remember that each baby is different, and variations in movement are completely normal. However, if you're in the third trimester, you should start paying more attention to the frequency of these movements. Now, if you've noticed that your baby hasn't moved in a while or the movement feels significantly less than usual, there are a few steps you can take. First, lie down on your left side in a quiet room, away from distractions. This position allows better circulation, and it may help you feel your baby's movements more clearly. You can also try drinking something cold or eating a light snack. Babies often react to temperature changes or the intake of food. It may be the little boost your baby needs to wake up and move. Stay calm and monitor how things go. If you still don't feel any movement after about 2 hours, it's time to take further action. Another effective technique is to gently massage your belly or talk to your baby. Babies often respond to their mother's voice or even touch. You can softly call out to them or place your hands on your belly. Sometimes, all it takes is a bit of bonding to get them moving. Even though it's completely normal to feel anxious when you notice a decrease in movement, it's important to trust your instincts. You know your baby better than anyone, and if you feel something isn't quite right, it's always best to contact your doctor or healthcare provider for reassurance. Now, let's talk about when you should seek medical attention. If you notice a sudden, dramatic decrease in your baby's movements, or if they stop moving completely after a consistent pattern of movement, it's time to call your doctor or midwife immediately. They may want to do an ultrasound or a non-stress test to make sure that everything is okay with your baby. It's essential to be proactive, as reduced fetal movement could sometimes be a sign of problems with the placenta or umbilical cord, or it could indicate a lack of oxygen. But keep in mind, a change in movement doesn't always mean there's something wrong. It's simply important to check and make sure your baby is safe. The bottom line is that it's always better to be safe than sorry. If you notice a change in your baby's movement patterns, or if you're unsure about what's going on, don't hesitate to reach out to your healthcare provider. It's important to trust your instincts and get the help you need for peace of mind. And don't forget, I've listed some helpful baby products below in the description. These products can help support you during your pregnancy and postpartum. Click on the link to check them out. Thank you so much for watching, and if you found this video helpful, please share it with other expectant mothers. Don't hesitate to leave any questions or comments below. I'd love to hear from you. Take care of yourself, trust your instincts, and know that everything will be okay. Stay safe, and best wishes for the remainder of your pregnancy.